Hello, students. Welcome to week 11. We're going to be covering chapter 11 this week, which is on case management. Case management is only one of the roles that human service workers can fill, but the probability is very high that as an entry-level person in the field, you're most likely going to end up working in case management, or that's going to be part of the services that you are involved in. Another term for case management that has come out is service coordination. And so you may hear that in replace of or in conjunction with the terms case management. It has become a cornerstone for service or processes in most human service systems. Case management is critically important for many people, as it has the potential to address many of the problems involved in human services. And in considering the application of case management approach to human services, a number of factors must be taken into account, including the model of case management, the level of intensity, the critical elements that must be present, and the requisite skills that are needed by a case manager. In its general form, case management has been defined in a variety of ways. And so a few of those definitions that your textbook gives are services that link and coordinate assistance from both paid service providers and unpaid help from family and friends to enable consumers to obtain the highest level of independence consistent with their capacity and their preferences for care. Another definition is a method of providing services whereby a professional social worker addresses the needs of the client and the client's family, and arranges, coordinates, monitors, evaluates, and advocates for a package of multiple services to meet the specific client's complex needs. Finally, a third definition is a practice in which service recipient is a partner to the greatest extent possible, as assessing needs, obtaining services, treatment and supports, and in preventing and managing crisis. The focus of the partnership is recovery and self-management of life. The individual and the practitioner plan, coordinate, monitor, adjust, and advocate for the services and supports directed towards the achievement of the individual's personal goals for community living. Originally, case management meant to arrange services for your client, essentially to act as a broker advocate and to help clients negotiate the complex systems of care. Over time, the original brokering approach was joined by approaches to case management that differed in intensity, underlying theory of focus, and in clinical involvement. So there are several approaches to case management that we're going to take a look at. To begin, a fairly comprehensive categorization of case management models includes the brokerage model, the clinical model, the strengths model, the rehabilitation model, assertive community treatment, and intensive case management. And while these various models differ substantially, they share some of the same core functions, which include assessment, planning, service implementation, service coordination, monitoring, evaluation, and involvement. And so as we go through these different approaches, you'll see those pieces come out. And so the brokerage model of case management has the longest history of the identified models. It is a rather generic model that has been applied in many of the human services fields. The term brokerage refers to the service arrangement function. Since history in this model, much emphasis has been placed on acting as a so-called broker of services for clients. The brokerage model focuses on problem identification, plan development, and brokerage to services that will assist the client in solving and the identified problems at the end of the day. Next is the clinical case management model. This one has been defined by Cantor as an approach that addresses the maintenance of a person's physical, social environment and the goals of facilitating his or her physical survival, personal growth, and community participation, and recovery from or adaptation to mental illnesses. Unlike the brokerage model, the clinical case management approach, the expectation is that the case manager will provide clinical services. Case managers must thus have some significant level of clinical training in order to utilize this particular model. Next is the strengths model. The strength model of case management grew from a view that treatment and services for people with severe human service problems. The strengths model rests on two basic assumptions about human behavior. The first underlying assumption of this model is that people who are successful at community living are able to develop and maximize this potential, and that they have access to the resources they need to do so. The second assumption is that effective human behavior is mostly a function of and dependent on the amount of resources available to individuals. Strengths are focused on rather than deficits. Interventions are determined by clients. Community is seen as the locus of resources rather than an obstacle to overcome. Active enrichment of strengths and client self-identity are emphasized. Clients are connected to resources for improving their quality of life. Environmental support is provided to assist clients in moving closer to their personal goals. The case manager-client relationship is viewed as the primary essential tool in the helping process. Next is the rehabilitation model. The rehabilitation model of case management has primarily been promulgated by psychiatrist William Anthony. This model shares many similarities with the strengths model. There is a primary concern with identifying the individual client's unique needs and goals, rather than having any focus on the overall goals of the formal human service system. A characteristic of rehabilitation case management model is an emphasis on assessing skills deficits and the remediation of instrumental and affiliate skills that could prolong community stay and promote the attainment of the client's personal goals. Rehabilitation case management focuses on helping clients find success and satisfaction in the social environment of their choice with the least amount of intrusion by clinical professionals necessary in order to support client strengths and remediate skills deficits. Next is the high-intensity case management models. There are three models identified by your book: the PACT, the ACT, and the ICM. And so I'm not going to go into any detail with these, but they are high-intensity case management programs that are almost always reserved for people who have severe and persistent mental illness combined with potentially homelessness or substance abuse problems. And so the intensity increases because the significance of the issue increases, or the levels of issues start to increase. Often the case managers in these situations will have a much smaller number of clients that they work with, because they're going to be spending more hours with each of the clients because they just need that additional help. The PACT was the first to be implemented in the 1980s, followed by the ACT model. They both require provision of clinical service by case managers. However, in PACT and ACT, the case managers are in a team consisting of full or part-time psychiatrists, a nurse, and multiple case managers. And so they work as a team to help individuals rather than working from an individual level. The National Association of Case Management was developed a description of case management based on intensity levels. And so they have level 1 case management. Let me see. Oh, so the PACT and ACT and ICM would be all forms of level 1 case management, excuse me. And lower levels would need less intense care. So case management has been used in a variety of settings. Case management is utilized in a variety of settings, as there has been an increasing growth in the complexity of service systems and financial reimbursement. Obtaining the human services case management has often become more difficult. And so in some situations, an individual may be in need of that targeted care, but are unable to achieve it because of the cost and financial reimbursements and things like that. And so one of the areas that it has been used in is alcohol and substance abuse treatment. This is more of a relatively recent phenomenon, but the recognition that there are often other either mental health concerns or other issues that go along with alcohol and substance abuse that may need to be managed. In addition, child welfare. Case management has a long tradition of being used in the child welfare system, both in traditional child welfare services and in new family preservation approaches. And so in some of the functional family models and things like that to help maintain families in staying together versus only when children are removed from the home. And so they kind of get started in an earlier level. Next, child and adolescent mental health services. Case management is viewed as a critical component of these services. In particular, human service systems term case management is being supplemented by the phrase service coordination in this arena to communicate that people in need are not cases, but they need to have those services. Next is long-term care for the elderly. Dramatic growth in the aging population is expected to accelerate between now and the year 2050, which has contributed to the innovation of case management services for the elderly who have unmet needs. There's been particular emphasis on the development of case management programs whose primary objective is to keep the elderly out of nursing homes and long-term care facilities as long as possible. So how can they get them the treatment that they need in the community and in their homes so that they can stay there as long as possible? And then the final area identified by your text is HIV and AIDS services. And so as the number of people with AIDS and HIV has multiplied, it has become apparent from a public health perspective that the disease is so catastrophic that any comprehensive array of services, both medical and psychosocial, would be necessary for no other reason than to provide adequate systematic care and reduce the transmission of the disease. And so there's reducing transmission, there's caring for individuals' medical needs, their emotional needs, and any other kind of needs that they might have, potentially through the progression of their illness. There are definitely some issues identified in case management. The first is unrealistic expectations. Case management has become an extraordinarily popular method for dealing with human service public policy issues, yet expectations for the results of case management have been unrealistically high, especially when individuals are often have high number of individuals they're working with, you know, the propensity to work long hours and also not get a lot of pay. And so this tends to be a big challenge. In addition, looking at advocacy versus social control. And so advocacy for the client has been described as important, if not critical, in case management. However, human service advocacy defines and promotes the well-being of the individual client, the group, or the community. But case managers soon discover that programs, agencies, and systems that fund case management create written protocols for the service delivery that are intended to identify the eligible clients and to specify limited services to those individuals. And so these protocols may be rules, regulations, laws, or combination of the three. And unfortunately, the role of advocacy in case management is more often than not simply lip service that's given in formal systems of care, particularly when funded or operated by governmental agencies. And so as case managers, we want to do advocacy for the people that we're working with to help them in any way possible and to be more self-sufficient. But in a lot of cases, we can do that advocacy work, but nothing comes from it. And, you know, we want clients to be hopeful and advocate for themselves as well. And often they're faced with more and more challenges. Next is human resource development. And so case management can be a demanding methodology, and thus the work can be extremely intense. But typically a case manager job is an entry-level position within an agency. Agencies usually employ people with associate's or bachelor's degrees as case managers, preferring degrees with human service focus. People with advanced degrees may be employed as case management program team leaders or as supervisors. There are few comprehensive academic training programs focused on case management, and so most job preparation ends up occurring after employment through pre-service or in-service trainings through the agencies that you may be hired from. Burnout is not unique to case management or to human services, but it is most common in people who work with the service recipients of all sorts. And can happen in many occupations. Burnout refers to the sense of emotional and physical exhaustion that can result from intense relationships that place stress on those responsible for the provision of services to others. Again, like I said, you know, working in high stress situations with a lot of clients and sometimes not a lot of payoff. You know, working to help clients and being faced with additional barriers just tends to really burn out different individuals. So some of the summary of material included in this chapter is the core functions of case management, different models of case management, what PACT, ACT, and ICM are, important issues, and because we didn't go over the PACT, ACT, and ICM in any detail, that'll be particularly important for you to look at as you read this chapter. Other important issues, stress and national organizations connected with case management. And so as you read through the chapter, you want to think about these questions. How is case management defined? What are the core functions of case management? What are the different case management models? What are the 3 high intensity models? How does case management vary across different settings? What are some important case management issues to consider? And then finally, at the end of your chapter, there are recommended readings, some internet sites for you all to look at, and the Connecting with My Helping Lab activities if you want to explore this topic in more detail. And so thank you so much for listening to this, and I look forward to catching you with the next video.